Although loneliness is often viewed as a problem for the elderly, a recent study by the Mental Health Foundation found that 18 to 34-year-olds were likely to feel lonely more often than over 55s. Studies have shown that between 20 and 80% of adolescents report feeling lonely often, compared to 40 to 50% in an elderly population. The researchers said greater priority be placed on social skills training for children in schools, while doctors should be encouraged to include social connectedness in medical screening, she said. Councils should also ensure there are sufficient social spaces that encourage gathering and interaction, such as recreation centers and community gardens. There is robust evidence that social isolation and loneliness significantly increase risk for premature mortality, and the magnitude of the risk exceeds that of many leading health indicators, added Dr. Holt Lundstedt. With an increasing aging population, the effect on public health is only anticipated to increase. Indeed, many nations around the world now suggest we are facing a loneliness epidemic. The challenge we face now is what can be done about it. A recent study by the University of York found that lonely people are around 30% more likely to suffer a stroke or heart disease, two of the leading causes of death in Britain. But the reasons have remained unclear. Some researchers thought it was simply that there were fewer people to notice when a person was ill or encourage them to take care of their health. However, last year Harvard University found that having no friends was linked to increased levels of blood clotting protein, which can cause heart attacks and strokes. It is now known that social isolation activates the fight-or-flight stress signal, which increases levels of protein fibrinogen in anticipation of injury and blood loss. But too much fibrinogen is bad for health, raising blood pressure and causing the buildup of fatty deposits in the arteries. People with just 5 people in their social network had 20% higher levels of fibrinogen than those with 25. Having 10-12 fewer friends had the same impact on levels as taking up smoking. The new research was presented at the annual meeting of the American Psychological Association.